Okay,
Great.
looks like everybody is in, so I'll just keep admitting people as they arrive.
Brilliant. I'll make a start then. Thank you very much. So good evening, everybody, and thank you for joining us. Thank you on this sunny, very sunny and warm evening. Well, it is anyway here in Staffordshire. I'm not actually in San Francisco. So this marks day 2 of Dietitians Week, and we wanted to take this opportunity to promote the diverse range of roles that diabetes dietitians undertake. So thank you for giving us an hour of your time this evening. And thank you also to our panel who are giving up their time this evening. So there's a few web addresses and handles there for our Twitter and Instagram on the slide, which you may want to make a note of. I can put them up again later on if you like. But I'm just going to move swiftly on to a few areas of housekeeping. So because of the nature of this call being Zoom, we would ask you to please stay on mute. Please keep your camera off. If you do have any questions, and we would very much welcome questions, please submit those via the chat function rather than unmuting. And there are some instructions there for those of you who want to make sure you only see the speakers on the screen rather than seeing everybody else as well. Okay, so I'm going to stop sharing the slides there. So hopefully you can just see us now. So I'll just give you a brief introduction to the purpose of this webinar. So over the next hour, I'm going to be introducing you to 6 outstanding dietitians working in the field of diabetes. So I've had the pleasure of working with many of them, but some I do not know so well. And so I'm as keen as you are to learn about their roles and their careers, and ultimately to hear about how they make a difference in diabetes. So once again, thank you very much to our panel for giving up their time to join this event. So I'm just going to talk a little bit about Dietitians Week. And just in case you have no idea what a dietitian is, or you've accidentally joined the wrong webinar, before we go on to hear who our panel are, I'll just tell you what dietitians are. So dietitians are regulated health professionals that assess, diagnose and treat nutrition and dietary related problems, both at an individual level and a population or public health wide level. So we're regulated by the Health and Care Professions Council, the HCPC, and our professional association is the British Dietetic Association. So we're educated at university level, and we undergo practical training, a number of practical training placements before we qualify as a registered dietitian. So if you would like to know more about how to qualify as a dietitian, we can talk more about it later on during the discussion, or you can go to the British Dietetic Association website, which is bda.uk.com, and there's lots of information there about what dietitians are and how to qualify as a dietitian. So who are we? We are DSG, or Diabetes Specialist Group. The Diabetes Specialist Group is one of 21 specialist groups within the British Dietetic Association. And our goal is to provide a forum for dietitians with an interest in diabetes. And what we do is we aim to support and share best practice, to inform and educate our members, to promote the role of the dietitian within the MDT. And ultimately, this will improve, hopefully, the care of people living with diabetes. So ultimately, we're here to help people with diabetes. And we work very closely with other organisations such as Diabetes UK, so they're a close partner of ours. And again, if you'd like to know more about what we do as DSG, you can visit the DSG pages as part of the BDA website. And if you're a dietitian, then by all means you can join us if you're not already a member. It's very good value. So before I go on to introduce each panel member, I think we were going to conduct a poll, and I'm not sure if that's possible at the moment, Julie. Julie's our technical champion this evening.
I'm going to try. I'm going to launch a poll. So let's see if we can get to know you.
There it goes. So we're just interested to know who's here. So we'd like to know if you're a dietitian or not a dietitian, if you're a diabetes specialist. Okay.
Ooh. A couple more seconds. There's still a few voting.
Lots of student dietitians. That's excellent.
Yeah, so pleased to see you.
Brilliant.
Any more? There's a few of you not voted. Any more want to vote? Okay, cool. I'll end the poll. Thank you.
Thank you.
Welcome.
Okay, so quite a few diabetes dietitians, but the top one is student dietitians. So over half of you are student dietitians. So a huge warm welcome to you. And I know as part of your, if you're a member of the BDA, as part of your BDA membership, you can select some of the specialist groups to be part of, and we would very much welcome you to select the Diabetes Specialist Group as one of your groups. Yeah, so get in touch if you want to know any more about the group, or if you want to talk to any of us. And then we've got a few other healthcare professionals and quite a lot of diabetes dietitians, which is great. So I think I'm going to share the results. Can we share the results? I click the button.
Oh,
there we go, sharing poll results. I'm not sure how that appears on your screen.
yeah.
Great. All right. Thank you for that, Julie. That's excellent. And I do want to also express a huge thanks to Julie for helping to organise this webinar and for being our technical support this evening. Julie is on the committee of DSG as our events coordinator, formerly the chair. So yeah, she's a very, very important person. So moving on to another very important person, because everybody here is very important this evening, I'm going to introduce our first panel member, and that is Louise Simpson. So Louise is a passionate and dedicated dietitian with many years experience of working in the NHS. So her main specialty is diabetes care, and she guides clients by adapting their cultural foods through meal planning, alternative cooking options, and creating a healthy, sustainable lifestyle. So Louise works in a short-term NHS specialist service for patients who are currently taking the maximum dose of oral medication and who require specialist intervention from diabetes specialist nurses, dietitians, and GPs with a specialist interest in diabetes. So welcome, Louise. Thank you very much for joining us.
Hi, everyone. Thank you for having me.
So I've got a question for you, first of all, before I move on and introduce our next panel member. So what made you decide to become a dietitian, Louise?
Oh, it's such an interesting question. So initially, I had an interest in sports nutrition. But then what I've noticed, the increase in type 2 diabetes within my community, really, I started to become interested in, diabetes. So, I did the research and went off to university. I've always been interested in diabetes, and you'll see it in my, as I was studying as a student, everything I did was always related to diabetes. And that's really where it came from. So before that, I was a diabetes champion. You can volunteer to be a diabetes champion. So as you probably can see, diabetes is running through my blood in the sense, so we say. I'm, really interested and really passionate about it.
Great, thank you. So not just a professional interest, but personal interest in diabetes as well, because of the close links with your community and the experiences they have. Yeah.
And I think that what had happened was there was a close link with the community, but there was a lack of understanding. And it was that term, I've only got a touch of diabetes or a little bit of diabetes, and things like that really sort of ignited my passion for diabetes. And dietetics sits so perfectly with a condition like that.
Yeah, brilliant. Thank you very much. Well, we'll be talking to you some more later on. So thank you very much for that. So the next panel member that I would like to introduce is Dr. Dwayne Muller. So after moving from working clinically in diabetes into diabetes research, Dwayne has moved through academic roles, initially teaching on dietetic programs, but he is now senior lecturer at Aston Medical School, where he leads on nutrition and evidence-based medicine, along with teaching gastrointestinal physiology. That's easy for me to say. He is the Associate Dean of Education, which relates to quality enhancement within the College of Health and Life Sciences at Aston University. So he maintains his links with dietetics, being recently appointed as an associate editor for the Journal of Human Nutrition and Dietetics, and as a visitor for the Health and Care Professions Council, and obviously as a committee member of the Diabetes Specialist Group of the BDA. So yeah, Dwayne and I have worked together over several years. So welcome, Dwayne. Thank you very much for joining us.
Thank you for the invite.
So I have a question for you, first of all. I'm interested to know, how did you make the move from working clinically into diabetes research?
When I took the move, it was a time before NIHR, and I know you've got Dr. Paul McArdle, we should acknowledge that as well, through the NIHR process, which allows you to remain clinically. I had to step out slightly from my clinical role. There's an opportunity through working with the diabetes team. There's a clinical trials unit. I started doing a bit of research, and it evolved into a PhD. But unfortunately, at the time, there wasn't the route to continue clinically. So that sort of pushed me towards academic work. And that sort of is difficult because you lose a clinical touch with diabetes. But fortunately, through Diabetes UK and Young People's Holidays, and then working with the group, and now I'm in a place working in a medical school where I'm starting to get involved in some interesting research projects with the community. And similar to Louise, is actually looking at different ways of doing diabetes, because we know that a lot of communities don't connect and don't see the clinical way we deliver dietetics in diabetes fitting their lifestyle. So it's looking for different ways of working.
Okay, great. Well, it's great to have you here. We will be coming back and talking to you again later on. Thank you, Dwayne. So our next panel member that I have the pleasure to introduce is Raphaela Brooks, who is a pediatric dietitian. So Raphaela works as a pediatric diabetes dietitian and team leader at Gloucestershire Hospital's NHS Foundation Trust, and cares for 270 children and young people with type 1 diabetes. Wow. Raphaela must be very busy. Within her clinical role, Raphaela has successfully introduced social prescribing, including diabetes camps and download clinics, the introduction of Libra and continuous glucose monitoring pathways, annual review and education, and is heavily invested in quality improvement as well. Raphaela is chair for both the Southwest Pediatric Diabetes Network and for the pediatric subgroup of the Diabetes Specialist Group. She also works as a module leader for the Diabetes and Young People module at Southampton University. Raphaela has recently been successful in getting a grant focusing on a new 16+ diabetes service. Wow, that's a lot. You're a busy person, Raphaela.
No wonder I look quite so haggard.
well, congratulations on your grant anyway, and welcome. Thank you very much for joining us.
Thank you. Thanks for having me.
So I've got a question for you first of all, when we're straight into the nitty-gritty here. Actually, what do you think are the most important skills and qualities for working as a pediatric diabetes dietitian?
Yeah, so good question. I think probably for me, the main one would be, and this is probably similar for adults as well, the main one would be around being a good communicator and being able to build that rapport very early on with families. We've got families of children who may have other needs as well, and very young children. So just yesterday we had a 13-month-old diagnosed. And that's a devastating diagnosis for that family. So being able to build that rapport and actually be very much patient focused and a good communicator throughout, I think is massively important. The other thing as well is around being a good educator. So we know that we're going to have to provide education ongoing. And to start with, that might be education to the parents, and then we may progress to giving the education to the child and young person as well. And I think the third thing for me is about trying to be creative and innovative with our children and young people. So that's why we do and are passionate about things like social prescribing and being able to offer things outside the box to really get to know our families and encourage self-management. So things like circus skills, cookery sessions that have moved to virtual cookery sessions during the pandemic as well. So that would probably be my 3 things to focus on, particularly in paediatrics.
Wow, it's a lot of skills and qualities, and it actually sounds like a lot of fun as well as being.
It is a lot of fun, yeah.
Quite a big role. Great, that's excellent. Well, thank you very much for joining us. We'll be coming back to you later on. So our next panel member to introduce, gives me great pleasure to introduce William Hadfield, or Will, as we all know him. So Will is a clinical lead dietitian at Xyla Health and Wellbeing, which is an NHS provider delivering the NHS Diabetes Prevention Programme, as well as NHS low-calorie diet programme nationally. There's also regional programmes such as Rewind in Northwest London and Live Well Newham. So his role his role is to lead in the creation, development, and review, and to have clinical oversight of population level interventions. So Will's background as a diabetes specialist dietitian working in the NHS, he's also been part of the British Dietetic Association's DSG group, and has some experience in academia. All of these things support his passion for innovative and evidence-based education, enabling long-term behaviour change whilst informing research. Wow. So yeah, Will's another long-time member of our group and colleague and friend. So welcome very much.
Thank you for having me.
You're welcome. So yeah, I have a question for you actually. And again, this is a bit of a challenging one straight in for you. Given that you're in a sort of an alternative NHS provider position, we're interested to know, how do you define success in your role?
Gosh, what a question. So I guess success isn't just one thing in my book. It's loads of different things. If I've got my provider hat on, I focus on the key performance indicators that are within our contracts. So KPIs for sure, people might hear about them. But basically, when you work for a provider and you're providing a service for the NHS, if you don't perform, you don't get paid. And it's as simple as that. And you don't get contracts and you don't have a job. So within that, it's very objective. So I'm thinking about referrals to a service, conversion from referral to attendance, retention on a program, and then sort of clinical markers as well. So whatever type of program it is, but usually weight, increase in healthy habits, reduction in sedentary time, maybe looking at HbA1cs if we're lucky enough to get that biochemical data. But also thinking about the subjective as well. So, for me, it's the reason that I got into dietetics is because of people. It's the feedback from people, from our focus groups, our surveys, speaking to people, but also it's staff satisfaction. It's an innovative and thriving workforce. At the moment, we've got some London Met students with us. So success for me at the moment is helping them get through their placement. So lots and lots of different things. I guess just making a difference. It sounds really corny, doesn't it? But I think it's really true. As long as we're making a difference, we're doing a good job.
Excellent. I like that. That's a really nice rounded view of how we define success. So thank you very much, Will, and welcome. So we'll be coming back to you later as well. So next on to Julie, Julie Taplin, our organizer of this event and DSG committee member. So welcome, Julie. So Julie works for Medtronic, which is the world's largest medical device company. She delivers training and education to adults and children with type 1 diabetes, as well as their diabetes healthcare teams on how to safely and effectively use Medtronic's insulin pump and continuous glucose monitoring systems. So it's quite apt really that Julie's our technical lead for this evening. she's obviously got lots of technical skills, which is brilliant.
Lots of technical skills.
So
not always useful. But
and actually, I suspect Julie, well, I know because I know Julie, has more strings to her bow. So my question to you, Julie, is: have you always worked as a dietitian?
No, I've job jumped a lot. So I'll just give you a brief history because I'm quite old now, so I've done lots. So I left school at 16 with about 5 GCSEs. Went and worked in banking for a few years up in the city of London, and then I got a job as a secretary. And during the time I was a secretary, I did a course in teaching aerobics, step aerobics at the time, if anyone remembers that, Reebok step aerobics. And so I did that, worked as a personal trainer for 10 years in a gym. Really loved that. But then I met my current husband, and he had a degree in something very, very sort of different, computing. But I was like, well, I want a degree. What do I know about? So I thought, well, I know about exercise and I know about food because I eat that. And at the time I was very lucky. The NHS were doing a bursary. So I applied. I obviously didn't fit the criteria. I had 0 qualifications bar my few GCSEs, but I was able to access the course through doing a different program and upskilling, and so yeah, so I at the age of 34, I became a dietitian. 2006, worked for the NHS for 10 years, most of those in diabetes. Very early on, I realised that I really liked diabetes. It was the education, particularly the group education, that I loved. And then 4 years ago, just over, a job came up in Medtronic. I quite like technology, and it's working with people with type 1 diabetes, and so I jumped ship, as it were, to the dark side, as it's known. So, but it's not so dark. It's pretty cool, to be honest. So here I am, and I've been a chair of the committee and been on committee for about 6 years, which I love. You guys are great.
Great, thank you very much, Julie, and welcome, and thank you again for organising the event. And not only Julie's being very modest. Not only was she chair of the committee, she led us to winning Specialist Group of the Year. So thank you very much for that.
It's actually about this a massive high. I mean, people say, "What's your high points in your life?" That will always come up as one. That night was amazing.
Well, speaking about high points, I've got a low point for you. You said, does anybody know what step aerobics is? Well, I used to go to step aerobics. I know I may not look it, but one time I fell off the step, and the instructor stopped the whole class to come and check that I was okay. so that
just
was
step over you.
So that was rather embarrassing, but never mind. I can laugh at myself. So great, thank you, Julie. We'll be coming back to you again later on. So moving on, and last but most definitely not least, we have Emma Jones. And Emma is a freelance diabetes specialist dietitian and co-founder of We Nutrition, which was founded 2 years ago. Emma's We Nutrition role involves providing one-to-one dietetic appointments for people who need specialist support to manage all forms of diabetes, as well as regular contact to make sustainable lifestyle changes. In the last 2 years, We Nutrition has worked with organisations including the JDRF, BDA DSG, ourselves, Muscle Food, Exante, Carbs and Cows, Motivate PT, Gusto, Louise Parker Method, and Healthy for Men magazine to deliver group education sessions, app and resource development, blog content, and corporate menu analysis. Wow, you've been very busy. Emma is also a type 1 diabetes educator in a large teaching hospital in London, specialising in diabetes technology, and is studying for her supplementary prescribing course. Welcome to the club. I just completed mine. It's hard work, isn't it?
Oh, yeah. Thank you so much for having me, though. Yeah, should be done by the end of the month, so just head down until then.
Wow. Yeah. So yeah, thank you for joining us. This is going to be a very interesting and probably difficult question for you to answer. But my initial question to you is, what's a typical day like for you if you're doing all these different things?
Yeah, really, really varied, actually. Yeah, I mean, no day's the same. I know probably a lot of people would say that, but I guess it's trying to be really clever with time to try and fit everything in. So even that bit kind of walking to the tube and being on the tube in the morning is kind of sending appointment reminders out to people, triaging referrals that we've had, and kind of getting things firmed up. So writing invoices and getting appointments scheduled in. So I do try and keep it quite separate. So I do most of my private work in the evening, a little bit on the weekends, depending on how that kind of suits clients and the projects that we've got. So try and confine about 3 evenings a week or so to doing one-to-one appointments, and we'll kind of do that in a clinic format. So that could be people who need support with gestational diabetes. So perhaps they want to get that diet education as soon as possible. It can be people with type 1 diabetes who need perhaps a little bit more intensive support and want access to someone who can help them with that. People with type 2 diabetes, and people who are looking for support to kind of make those healthy lifestyle changes as well. So alternatively, if I'm not doing one-to-one appointments, there can be lots of different project work as per that list that you just read off there. So it's hugely varied, and we get approached by lots of different companies and people to see if we'd be interested in helping them out. So it kind of, our social media pages and being on the BDA freelance page really kind of opens up a lot of doors to lots of different opportunities, but lots of different exciting things. So it can be kind of communicating back and forth with chefs to try and really pin down what's on the menu, so to speak, to try and get that carb count as accurate as possible, or trying to get the tone right for lots of different blogs and articles and things like that, depending on the publication. otherwise might try and fit in some meetings after work. Had a meeting with our accountant the other day, so very essential. Someone's skills that I definitely don't have. So yeah, super varied, and a really good way to kind of meet lots of different people and try new things.
Excellent. Wow, it does sound very interesting. Yeah, I can relate a little bit. I also do freelance work, and so I know that one of the reasons why I carry on doing it is because of the variety. And you know, you're sort of continuously challenged by something new and different, which is always nice, isn't it?
Yeah, 100%.
Yeah. Thank you very much for joining us. We will come back to you. But yeah, just to really draw the contrast, I'm going to start the panel discussion with questions directed at Raphaela and Louise, really. So we've just heard Emma talking about freelance and private practice, but you both work in the NHS, which is where the majority of dietitians work. So I'd like to ask you both, what's the most rewarding aspect of being an NHS diabetes specialist dietitian for you? Let's start with Louise.
Thank you. So for me, I'm similar to Julie, actually. I really get a buzz from doing group education. Now we're virtual, it's very different, and we've had to learn to adapt and do things online and virtually. But I do think that that's a good thing as well, because now we can, see more people, and there's that comfort of your own home. So yeah, group education, but it's when the penny drops. I think that's the biggest thing for me, when a patient gets that ta-da moment and they're like, oh, I never knew this. So I've had diabetes for 10 years and I didn't know that. And I think that that's a really rewarding element, because you know that they're going to be able to take that information, implement it, and implement it and make health lifestyle changes to their life. And I think that there's also the journey of success when they're starting to really see differences in their diabetes control. But even if someone doesn't get that, it's that understanding, when they're able to just build on their understanding and they can become independent in managing their diabetes themselves. So yeah, that's kind of the rewarding part of it.
Excellent.
For me.
Yeah, that's great to hear. Thank you. I can relate to that. Raphaela, what is it for you? What's the most rewarding aspect of being an NHS diabetes specialist for you?
I think Eloise has definitely touched on some of the points already. I think as well, within paediatrics, we have sort of a certain tariff applied to us. So we have to meet a certain amount of contacts with our families. So we do get a lot of regular contacts with our families. And I think that's definitely a bonus of being within the NHS, just to have that regularity and getting to know the families as well. And the other thing as well, by sort of working within the NHS, we submit information and outcomes to a national audit, and that's really good as well to have that sort of platform, and you can see improvements year on year on sort of diabetes control and access to technology, access to education, all those sorts of things. So I think that's really motivating when you see that and you see the data. And it's not just about the data, obviously it's about patient experience, but I think that definitely helps to G things along and get more money as well for our patients as well.
That's brilliant. I mean, without wanting to steal the whole concept of this webinar, what you've both described is getting the feedback and the feeling that you're making a difference, isn't it? Yeah. Which is great. And that's like what Will was saying earlier on. Brilliant. That's really good. Thank you. So I'm actually, speaking of Will and Dwayne, it may not be immediately obvious to those of you who aren't familiar with our profession, given that there are several male dietitians represented here, but actually less than 10% of dietitians are male. So I'm interested to ask Will and Dwayne, how did you first come across dietetics as a career option, and how do you think we can get that number, that percentage of male dietitians up? Let's start with Dwayne.
I've just actually checked, it's 6.5%.
It's poor, isn't it?
And that's the latest snapshot from the HCPC. And it just fluctuates a bit. It's 650 of us. And we do tend to cluster, as you've got 3 here. And you do tend to find that with any sort of profession, that the minorities within a profession do tend to cluster together. And there's probably more men in certain specialities and certain departments. I know one department in this country where they've got enough men in the department to have a 5-side football team. So, there is that clustering. How do you change it? I think the difficulties are role models. And what we need to be as a profession is you can't get a role model that's the same as everybody. So we need to be clearly diverse and clearly welcoming of difference. And that's not easy for any profession to be, because through the processes you go into it, the way you study, the way you're selected, the way you're interviewed, that tends to encourage a certain type of person. And we need to be clear from talking about dietetics as a profession, showing the public face of dietetics, but also when we're bringing people into the profession, to show that we embrace and welcome difference. And we like that challenge of difference, because if we're not careful, we can be very, very tied into one type of person. And that's not healthy for any organization, any profession, any business. So the more difference we get, the better and the stronger we'll be.
Okay, excellent. Thank you. And just in relation to how you got into the profession, tell us a bit about that.
I had an interest in the sort of the science of food and the chemistry of food. I can remember sort of the red cabbage experiments in chemistry and things like that. And then I kind of stumbled and found it as a profession because it wasn't visible. We didn't have dietitians on the TV back in the 90s. Just checking it wasn't nice, wasn't it? I was checking how long ago. We did have TV back then, but there wasn't that sort of same visibility. So there's much more visibility now, and we're getting much more diversity. And we need to push that further and further. So, and again, a little bit like Eloise, is that interest in sport. But being a rugby playing dietitian, there's not many of us. I know at least one other that's a similar shape to me. But that's the other thing we need to celebrate, is the different shapes of dietitians as well as the other differences that we see.
Thank you. Thank you very much. I think Will used to play rugby. Didn't you, Will?
Very, very poorly.
So, Will was part of a rugby team from what I remember. Anyway, I'm not sure how much rugby went on and how many other things in social activities were the
More of a
focus.
social club, wasn't it, Will?
So yeah, Will, what about you? How did you get into the profession?
So I guess, when Dwayne was speaking, it was really resonating with me, because it was just a stumble upon it. I remember I was going through the UCAS process, and it was very much like, if you're interested in something healthcare related, then you can be a doctor. If you're a boy, you can be a physiotherapist. If you're a nurse, you can be if you're a girl, you can be a nurse. It was sadly very gender stereotypical. And I was like, I love food, I like eating, I like science, and I like people. Let's do it. So it was it was kind of research, it was kind of chance, but it just made sense and it fit. And then I sort of stumbled across diabetes, where you get to really work with people on like a really deep basis. And I think that's just what's fascinated me. I love working with people. Louise was saying earlier about that light bulb moment, and I was like, yes, that's it. That's, you sort of leave work for the day and you're like, yeah, that was really good. How do we change it? Well, I think it's just, Dwayne hit the nail on the head. It's role models, isn't it? We need to keep representing. We need to keep showing up, keep trying. It's an exercise in perseverance, isn't it? We just need to make sure that we are seen, all shapes, sizes, all the different ways in which we come. Because we are the smallest profession. If you think about doctors, nurses, physios, speech and language, occupational health, we're really the diddy ones. Sometimes we're not even at the table. So when we do get that opportunity to be at the table, we really have to show up and represent. We have to make ourselves heard. So if anybody gets a seat at any table, wave the flag for dietitians.
Including male dietitians, obviously.
Male dietitians, but yeah, I mean, you guys know that this is something that's really big for me, about speaking up. And even if you feel a bit out of your comfort zone, just say yes to the invite, because we need to be in there.
I agree. Thank you both. That's great. Excellent. And I'm going to be coming back to you again in a moment, Will. But this is a question really direct to Eloise and Will. So since you've qualified, since you've been working in diabetes, how do you think the practice of dietetics in diabetes has changed, and how do you think it will change in the next 5 to 10 years? So what have been the changes that you've seen, and what do you see coming? So Eloise, we'll start with you.
Yeah, so I'm probably I've only been in this field for probably about 5 years. It doesn't feel like that for me because I've had such a passion for diabetes for so many years. But what Will and was talking about earlier in regards to role models, I think that where I really find my passion is that, you know, it's that when people come to clinic and they look like me and they see me, I see that connection. They feel that you know, oh, I'm seeing somebody who's going to understand what I'm eating and what I'm drinking. And I know it might sound small to some people, but it's major. If you think of a 70-year-old nanny, you know, who's now got diabetes, come from Jamaica, come over to England, she's seeing somebody who understands her food. So I think the culture, the diversity, I think conversations like this that we're having, and also social media, you know, it's really growing, isn't it? And there's lots of dietitians, fantastic dietitians on social media who are sharing their food, sharing their culture, sharing their day-to-day, and that really has an impact on diabetes control, because diabetes isn't just a number where, you know, you do this and it yields that. You know, there's so many factors, isn't there? Your culture, your religion, social, all these social factors. So I think in the next 5 to 10 years, with the booming of social media, and, you know, as Will was saying, waving that flag and attending meetings and being at that table, I think that we're going to get a more diverse playing field. There's going to be more people who look different, you know, and are different, and that's what we want. That's what we want.
Excellent. Yeah, so a more representative profession, hopefully. Yeah, that would be really good. Yeah, thank you. Will, do you have anything to add to what Louise has said?
I guess the way that I would kind of think about this is, what is going to change is maybe the way that we work. We've had such a massive shift in the last year, but I guess when I think about the way that we work, we really need to work in a way that meets the demands of the world in which we live. Taking obesity and type 2 diabetes, for example, we know that we're at a point where something needs to be done. And within my role at Xyla Health and Wellbeing, it's about the diabetes prevention program. You know, it's doing things en masse. We're not doing groups of sort of 6, we're doing groups of 10, 15. We're seeing thousands of people at a time. If we look at the low calorie diet program, across the 10 sites, each site is referring at least 500 people. It's about cranking up the numbers, and a dietitian's place in that, from my point of view, is very much in working with our colleagues to upskill where it is appropriate. So we know that there's always going to be those people that we work with that need that one-on-one specialist advice, but where we can work with our colleagues, like, you know, registered nutritionists, to work in a way that can reach the masses and bring the health of the nation up, I think that's really where we're going to see our skills employed to the greatest effect in the coming years.
Yeah, great, thank you. I agree. We, you know, if we're talking about scale, you know, there's only so many dietitians that can be. Obviously, we'd like to be many more. But yeah, working through other people is really important, isn't it? Yeah, thank you very much. Great. Okay. So so going back to our theme of technology and our 2 technology gurus with us here, Emma and Julie, and this is a really topical question, I think, at the moment. What impact do you think technology has had on the role of the dietitian in diabetes? Let's start with Julie on that one.
I've just forgotten the word I wanted to use.
Huge.
I'm not usually short of words, but I've forgotten that one word.
Massive.
I would say it's visibility. So I would say people have much more visibility about what's going on with their diabetes, and it's taking out the guesswork. That was what I was going to say. Less guesswork. So previously, people with diabetes, you know, they might be finger pricking, but maybe not. And if they did, it's not particularly nice. And then it's a whole guessing game of how many carbs am I eating? Is my blood glucose level going up or is it going down? I'm doing some exercise. What should I do about that? You know, and I've got a party in a few hours time, and you know, so much guesswork needed to be going on. Whereas technology is definitely helping by doing a lot of the work. Some of it's really clever now. It's not cheap and it's not available to everybody. We know that yet. But it's definitely helping reduce the burden by taking out a lot of that guesswork. And it's proving to have better outcomes in terms of the biochemical stuff, but just in terms of people's quality of life. We see that coming through all the time.
Thank you. Thank you. And Emma, how do you think it's changed your role as a dietitian, all of these advances that we've just heard about from Julie?
I guess I'm really lucky that actually, in terms of the places I've worked in the NHS, diabetes dietitians have always been seen as equal to diabetes nurses in their experience and their ability to manage technology. And I suppose I'm fairly biased, but I think that we're so well placed to help to educate and support people and empower people to self-manage, because you're now in a position where, as Julie was saying, there's so many blind spots. It's almost like you're now turning on the light. You can see what's happening at all those points in between those perhaps few like painful finger sticks that people are managing to do. And actually you can then see, well, that's what's happening after I do that bit of exercise, after I have that food. And then can actually put things into practice, review, and actually, you know, feel better and enjoy things a little bit more. So I think we're super well placed to help people with that as well.
Great.
Yeah, I mean, we have a absolutely pivotal role, as Emma says, because so much is around education, and we are absolutely great at that. It's something that most dietitians kind of excel at. And technology is moving on, and it's moving on, as Emma will know, super quickly, and it's quite difficult to keep up with it at times. You know, it's just moving all the time. So one thing I would definitely say is, wherever you are, wherever you're becoming a dietitian at, is find out what the latest technology is and find out how it works, because with social media particularly, people with type 1 and type 2 diabetes, they know about this stuff now. We can't keep it secret from them. They hear about it, they ask about it, so it's our job to keep up with it. I mean, I'm in a unique position that I spend all day every day, you know, looking at all the different technologies, but even, you know, whatever area you're working in, it's good to have that awareness, because people will be asking, and it's exciting. It's very exciting.
Yeah. I had a patient yesterday in a clinic that their knowledge was just absolutely phenomenal. They knew about everything that was coming through the pipeline. You know, and patients as experts is, you know, that's one of the, you know, some of what you've said here today, guys, is about light bulb moments. It's about, you know, seeing the difference that somebody's made, and actually when you work with patients as experts, that's very rewarding to me. Anyway, that's brilliant. Thank you both. I'm going to move on because I'm conscious of time. We've got lots more questions to get through. Well, not lots, a few more. So this one is to Dwayne and Emma, but I'm going to start with Dwayne. So this is about, what advice would you give to someone who's considering a career in dietetics, other than obviously go for it? What advice would you give them?
I'd say be patient, because there's so many experiences to gather. Get a good grounding and a wide experience before specializing. I didn't. I went straight into diabetes, and sometimes I regret that, but I don't regret going to diabetes, of course. I think the other thing is keep doors open, because you've got the opportunity to work in the NHS, you've got the opportunity to work in private practice, industry, and you can, as we've got people here, they've got portfolios of those, so you can mix and match them. So listen to people, take time, and if you're sort of planning to study dietetics, try and choose a place that you enjoy studying in. Think also of the type of course. Some courses are slightly longer than others, so that might give you more time to do other things in between. And the other thing I'd suggest is think about, because some of the courses are slightly more science-based and linked into the biochemistry and the physiology. Some more on the human side, by looking at the social sciences and that side of thing. Look around and take advice on that, because different courses suit different people. The end product of being a registered dietitian is the same, but there's so many routes through it.
Thank you. That's really good advice. Yeah, I can relate to that. The different types of courses there. Thank you. Emma, do you have any pearls of wisdom to add to that one?
I think it kind of mirrors a lot of what Dwayne said. So I was thinking about actually the real benefit in terms of trying out lots of different things. I know that certainly when it sounds like lots of people stumbled across dietetics, I definitely did. I mean, I worked for quite a long time in acute and really thought that, my heart was right there in kind of tube feeding and things like that. And then not only until I got the opportunity to try a really kind of specialist outpatient service, I think, oh, actually, this is so much more up my street. And then it's not until I think I was on job number 3 or 4 that I thought, oh, type 1, that just like ticks so many boxes for me. But actually, I'm still able to kind of draw on all those different experiences from the few years before that to be able to kind of apply in lots of different clinical situations at the moment. So I think getting that good varied grounding is a really good advice. But also I think the other thing I found is we're all generally very friendly, approachable people who tend to big each other up quite a lot. So I think, we're all, I say, very approachable. So if you've got questions with someone on social media that you think, yeah, actually, I'd like to find a bit more about what you do, then I say, give it a go, get in touch with people.
Excellent. Yeah, I love that advice. Yeah, talk to any of us. That's brilliant. Thank you. Moving on to our last question before we move on to the finale for this evening. This is to Raphaela and Julie. This is a question about where should people go to find out more about becoming a dietitian or to learn about the careers? Was there anything that you came across that really helped you? Let's start with Raphaela, if you could, please.
Yeah, so obviously you've mentioned already the sort of websites to go and have a look at. I know when I was deciding to become a dietitian, I got in touch with the local hospital and went to one of their taster days, and I think quite a few hospitals are doing that. I know we've moved to sort of a virtual taster day, which isn't quite the same, but it's still something as to finding out different roles within the team. And another thing I did as well was volunteer on diabetes camps, and that was really good. And I know there's still opportunities to do that, whether you want to do that with the local team or with Diabetes UK. And actually I managed to get through the Canadian Diabetes Association, I went out over there for a summer and did the diabetes camps there, which is a whole new experience.
Wow.
And I know they are still doing bursaries and things, so if you can fund flights or find ways of funding flights, it's an amazing opportunity to go out there and see how they manage diabetes as well. So anything sort of extracurricular to get involved with, and seeing what places are doing and what other people are doing. And I think it's like you mentioned, Emma, it's about reaching out, isn't it, and actually networking and finding those opportunities.
Yeah, thank you very much. Yeah, that sounds really fascinating, the Canadian diabetes camp.
It was great. It was really good.
Yeah, excellent. Julie, what about you? Any extra tips from you?
Mine wasn't as glamorous as that at all. So I actually came across a dietitian when I was a gym instructor. So I just happened to be talking to a member, and she said that she was a dietitian, and they were just across the road actually. So that was kind of the thing that sparked my interest, because at the gym I'd done some talk presentations on healthy eating and things like that, so I had that interest there. Then I think there was a careers event at a local shopping centre. The NHS were there, so I went along and asked a little bit about it, realised that it was going to be a 4-year degree, and thinking, oh my gosh, I'm never going to be able to do that. How am I going to manage that? Because I was married, and obviously, and so I didn't want to go and stay away, so I sort of commuted backwards and forwards to London Met, but managed it, and managed to still do a little bit of gym work as well. So I pretty much came out with no debt. It's quite rare, isn't it? So yeah, but I think Emma said a lot actually about asking us, reach out. We're really passionate, as you can tell, about what we do. We love what we do. Sometimes it's tricky to get into the NHS services, I know, because of all the sort of different compliance and rules and regulations of confidentiality, but there's other sort of opportunities. And the BDA website has lots and lots of stuff about what it is to be a dietitian. There's a really great now curriculum on there, so a pre-registration curriculum that talks about sort of what things that you need in order to sort of, whilst being a student, but also, and it really is hot off the press, I think it's only about 2 weeks old, there's a post-registration curriculum and framework as well. So it's not necessarily job specific, but it talks about the skills and the background and the evidence base that you'll need and the research skills that you'd need to become a dietitian. So the BDA website is a great source.
Thank you both. That's great. And if you get stuck, you know, if anybody here is thinking about becoming a dietitian, I know lots of people here are dietitians or student dietitians on the call, but if anybody needs any help, just feel free to contact one of us. So yeah, so I'm going to try and save time for questions from the chat. I'm going to ask Julie if she could perhaps moderate and identify if there are any that we want to share. But while she's doing that, I suppose I have a final question to you all, and I think you've addressed it actually, most of you, but I want to give you that extra opportunity to just say, if you think there's a way in which you really make a difference in diabetes, if you could summarize it in a sentence, does anybody feel brave enough to do that doesn't feel like they've already done so? Speak up.
I'll take that one.
Thank you.
I think that for myself, I ensure that I'm personable. You know, so if someone comes, they can talk to me the same way that they will talk to a friend and a colleague. I don't want anyone to have like that white coat syndrome when they're sitting in a dietetic clinic, because the thing is, dietetics, a lot of people do have a preconception before they arrive, and they think that, you know, you're going to be a food police and you're going to tell them do not eat this and do not do that. So I think they get a bit they're very stunned when you say there's no specific diet for someone with diabetes. I think, so yeah, I think that I think being personable is definitely one of the key points.
Love that. Thank you, Louise. I completely agree with you. I've lost count the number of times when I've been working with the DSN, diabetes specialist nurse, and often our patients, because I work in an NHS service as well, often our patients will see the diabetes nurse first, or when we used to do face-to-face, and then they'll be offered to see me afterwards, and someone will say, oh no, I don't know if I want to see the dietitian. And so my goal in life, I'm not just there to be liked, I'm there to break down misconceptions really about what people think of dietitians. And it's the same, you know, in my private practice. I also work in mental health, in secure psychiatric settings, and again there we've got lots of preconceptions, not necessarily, you know, previous bad experiences, but preconceptions about what a dietitian is and what we do, and yeah, I like to upturn people's ideas on those by hopefully getting along well with them. yeah, I'm completely with you there. Anybody have anything else to add?
Something simple: don't keep doing the same thing that doesn't work. Have faith in your ideas and try something new. That could be in your career, it could be working with people with diabetes, and probably the biggest one is listen to people. You know, the lived experience. You know, Eloise has got sort of very clear experience and knowledge of food culture. You know, we can work with people from different food cultures and have no idea, but be willing to learn. It's a way we can connect with people by talking about the food they love to eat and working with them rather than trying to push against them, which I think historically as dietitians, that's been the case. We've been pushing this plate type model. I'm not going to say its name. Instead of actually working with the food that people love eating and working with them. And I think that'd be the tip. Stop doing the things that don't work. Be bold and listen to people.
Love it. I'm gonna end on that note, I think, actually, because we probably can't improve on those two last comments. I just want to ask Julie if she thinks there's any questions from the chat that are worth us discussing openly. I know some people have been responding in the chat to the questions, so some of the panel have been doing that. Thank you very much to the panel for doing so. What do you think?
There is something that's come up, and the conversation has been flowing actually about behaviour change, motivational interviewing, which sort of links into what Dwayne was saying there. That, you know, those kind of skills, I guess, it looks like people were looking for courses and areas to develop that. I can remember it's many years ago now, I was at university, we did a couple of sessions on there, but I'd be interested to hear from the students if you do any work on behaviour change or motivation interviewing, just to see what the current curriculum is about, because if there is a huge gap there, I think it's probably something that we could sort of
take forward,
work on. Yeah, I can see Raphaela nodding there. It's definitely, because it isn't that listening skills, and not as Dwayne has just said it sort of perfectly, those listening skills and working with people rather than just spouting what you know what you want to know. So telling, you know, people finding out what they want to know and not just what you want to tell them.
Yeah, it's not just a knowledge transfer, is it? It's much more than that.
But,
no, I agree with you.
Yeah, but thank you to the people that have responded to the questions there. The other thing actually is probably the other thing that came up, Paul, is probably actually to you, which was about prescribing, supplementary prescribing. So I don't know if you want to sort of elaborate, but basically somebody's asking, is it worth doing supplementary prescribing, and is independent prescribing coming anytime soon?
Well, I'll keep it short because we've just got a few minutes left. But basically, we don't know when an independent prescribing is coming, because it requires a change in the law. It's one of those things that when it happens, it could happen quite quickly, but it could also be a long time away. So in terms of supplementary prescribing, for those of you that don't know, a supplementary prescriber works in partnership with a medical practitioner and operates under a clinical management plan which is specific to an individual patient. Is it worthwhile? Absolutely, it's worthwhile. Not only does it advance our profession and your knowledge and skills and your standing within the MDT, but it puts you in a fantastic position for when independent prescribing does come in, because actually the training course you go through, annoyingly or not, is exactly the same. So I was on a course with 50 other health professionals. I was the only dietitian, and every single other person on the course was going to end up an independent prescriber, which was somewhat frustrating, but I sort of, what's the word? I consoled myself in the knowledge that actually, if independent prescribing comes in, it's only a 2-day conversion course. So it's not, you've actually done a lot of the work already, and you'll be in good stead for when independent comes in. The other thing is, it's the advantage to patients and services. Think about how you can restructure your services, advance and develop your role. You can give better access to the care that people need by becoming a supplementary prescriber, because you may well find that actually some patients are seeing the nurse or the doctor they don't need to, and therefore you can split out a bit more. And be a more valuable member of the team. So yeah, 100% it is worth it. Go out and do it. There are currently less than 200 prescribing dietitians on the HCPC register, which is rather poor, I think. So if you want any advice on it, speak to me or speak to Emma or speak to anybody that's done or doing the course.
I'm glad to hear it's worth it.
Yeah. I haven't actually written a prescription yet. I only got my qualification a couple of months ago, but I haven't written a prescription because we're doing everything virtually, remotely. And there's not really much point in writing a prescription because, well, you just write to the GP anyway. Yeah. So, but yeah, as soon as we're doing face-to-face things again, I'll be writing prescriptions. So, yeah, thank you for that. Well, I'm going to bring this to a close because it is, there's just a little bit of sunlight left here in Staffordshire. Which I will go out and enjoy. So I want to again express my huge gratitude to everyone for taking part, and to the 70 people who've joined us. I think it's really clear that the passion and enthusiasm for our profession and our speciality is really clear here. And what's hit me is that connection with people. It is what makes the difference for a lot of us. Listening and understanding people and working with them is a kind of, it goes to our core really, I think, as in our speciality as well as our profession, and that's come across very strongly this evening. So yeah, once again, thank you very much, everybody, and go and enjoy your evenings. So take care.
We may send you out a short survey, so if you can complete that afterwards, that would be great. But yeah, thank you, everyone.
Thank you, Julie.
Thank you.
Take care. Bye-bye.